Hello and welcome to episode 7 of Homeopathy Simplified, a podcast. And today we're going to talk about why I add homeopathy to my Bowen therapy practice. And I think for a lot of people, it's a good question to answer. So, just to introduce myself again, I first discovered homeopathy through my father, who in the 1960s was one of the key teachers of homeopathy's resurgence in Europe during the 60s and 70s. And I was fortunate to study through his students, and I feel a very strong affinity to his career. I also became a Bowen therapist and developed a practice focusing on chronic pain and disease. And after 27 years of practice, I've come full circle and I want to share my knowledge. And I've made a purpose of teaching a course that is really the one I wished I'd had in the very beginning of my career. A course created to make the complex simple and shine a path through a forest of ideas and misconceptions about homeopathy. So, the episode 7 is titled Why I Add Homeopathy with Bowen Therapy. And I often will. I first graduated as a homeopath, and I later learned that Bowen therapy, and it's a great therapy, so useful in treating both acute and long standing chronic issues. And as it treats pain, a large number of my clients come to me in pain after getting a referral from someone who has known me. Now, as a homeopath, it's hard not to want to try to help with that as well. And I've certainly had my successes and failures, but we'll talk about one that's very recent in this episode. So I'll give an example of just why the adding of a homeopathic remedies can be so helpful. Now, if you enjoy these podcasts, then please consider following the link in the notes to receive a free guide to 22 back remedies. So 22 homeopathic remedies for back problems that are laid out in a way that you can easily choose from them. You learn from the guide how to reliably select effective remedies for common conditions like back spasm, bulging disc, and sciatica. As a Bowen therapist that uses homeopathy, I can say that homeopathy helps my work enormously. All right, so follow the link in the guide in the show notes, and you only have to add your email to the newsletter, and you'll get automatically a link to the guide. Okay, so on with the show. So, as always, I look at the dictionary meaning of added, in this case, additional as well. And it really means more, resulting in an increase or in amount or number. So, in this instance, more therapy. And then the question comes, why? We're doing a body work, in my case, Bowen therapy, and it's a good therapy. It would work for the condition. But it's a question of how the client feels in between those treatments. So just the same as when you add in a anti-inflammatory, naproxen, ibuprofen, whatever it may be, it's always the first treatment for pain. I mean, this is what people will be told at their doctor, at their pharmacist, at their physiotherapist. And it's a great support for our patients because they need to be comfortable. And so already, most of them are already doing some sort of pain management. And in the second reason, an additional medicine to aid healing is going to be helpful, just as an anti-inflammatory. However, if we can be more specific with its effect on the healing mechanism, that would be very helpful. So a homeopathic is used differently than a drug. A drug you might recommend a dose every 4 hours if it's an anti-inflammatory. And that's good. It's going to maintain the anti-inflammatory state and allow the body to heal. That's the reason. It just keeps the inflammation down. But what may be underlying the problem is where homeopathic might be addressing. So here's a very recent case. This past Tuesday, a patient called. She's visiting from Australia on a holiday, taking yoga courses and cooking classes here in San Miguel de Allende. She'd left a few weeks earlier from Australia with a mild back and SI joint strain, and she had taken treatment there from a regular physiotherapist that she sees, and had made it through across the flight, and but then it went badly after being in Mexico a few days and taking a bus ride. The result was terrible sciatica with shooting, electric like shocks from the left glute all the way to the left ankle. I mean, really intense. She sought therapy and was doing rolfing, and she was still undergoing sessions when I met her last Tuesday. So, her symptoms, let's list the symptoms. And in homeopathy, we always look for the location, of course, in physiotherapy and Bowen therapy too. What is the pain like? In her case, it's shooting with shocks. What makes it better? She's better when she's sitting and also better when walking, but she's very much worse waking up and getting out of bed. So these are essentially the characteristics of her symptoms and her condition. These characteristics were absolutely true, and in the language of homeopathic symptoms, we would use these. And it's information you're already getting as a physical therapist. So my observations, mostly during treatment, and of course, in the interview, were as listed here. She had the left-sided inflammation at the sciatic nerve and piriformis. It was really like a bubble, like a cyst between the piriformis and the sciatic nerve in the middle of her left glute cheek. She also had lumbar muscle spasms. The neuralgia is the sciatic symptom. The sacral iliac joint was very inflamed on the left side as well. And then she also had hamstring tension. And as well, I should add in the ankle pain. There was one point of nerve discomfort on the left side of her shin bone near her ankle. So a treatment was given, and anyone who knows about Bowen therapy will know that the treatment is more like an undoing, an untherapy, where we try to undo the accommodated symptoms that you develop when you have a chronic pain, such as she had developed. And as you do the process of Bowen therapy, the body lets go and it can return to its ideal alignment. Now, I performed a long session and addressed the whole list of her symptoms. I take great care in the process to assess the response of the patient as they are receiving the treatment. And the question is why I'm assessing as to whether they can process the effect of the treatment I'm giving at each step. Because at a certain point, you fill a cup of tea, the cup overfills, and that can happen with Bowen therapy quite easily. So we also, in Bowen therapy, take many pauses, and that allows the body to respond. So during the interview and the summing up of the treatment, we talked about medications and decided she should continue what she was already doing, naproxen, but to take it on a regular cycle. And then we added in a remedy named belladonna, and this was for each time she had a major sciatic shock. She described it as just this electric shock that shoots through her whole left limb. And so we did a follow-up 3 days later, and she arrived in a much better condition where the intensity of her symptoms are down to just 30% of where they were when she came. So the question is, did the homeopathic help? And yes, according to the patient, it soothed the pain, reduced the duration of the pain, and lessened the frequency of it. However, after using it by about 10 times now over the 3 days, it seems to be having less effect. So what do? We do another treatment as well, because that's certainly part of the benefit that she's getting. Which is major, we don't know. It's much a guesswork to know. And it's really about the patient's opinion that dictates whether the treatment is helping or not. So we did Bowen therapy, and then I gave her as well a different potency of belladonna, in this case 10M, which means M is millesimal, meaning 10,000. You know, it's an intense amount of pain that she would have when she needs it. So, and that's still the case. I mean, the sciatic nerve is still inflamed. What's around it is much less inflamed. So there's more freedom of movement, less pain overall, and there's more space for healing. And of course, it was only 3 days following and already 70% improvement. That's great. So, and the question is, well, we don't know if the remedy or the treatment helped. It might all be placebo, and just being told to rest and take naproxen may have been enough. But nonetheless, the patient's opinion matters. They came back and spent their money on treatment, and were very, very happy. And she was more than happy because she knew that she'd be able to face the journey home to Australia, which was coming the following Tuesday. So there's a little bit of an example of why I think homeopathy and bodywork are such a good combination. So the patient had something to take with them to use intercurrently with everything else, and felt very secure with that. And certainly, if she has, for example, on the flight to Australia, a relapse of her sciatica, she may get benefit from the homeopathic remedy in that moment and get through it more easily. So that's the summary of why I think homeopathy is such a useful tool in working with people therapeutically with bodywork. So take care, and don't forget the show notes to get the link to the 22 back remedies for homeopathy for back problems. And we'll see you at the next episode. Thank you so much.